Hello, I'm Kerry from the Patient and Public Involvement team at the Royal College of Obstetricians and Gynaecologists. Thank you for joining us for our Women's Voices information webinar on younger women's health, where we'll be talking about vulvas, vaginas, periods, pubic hair and much, much more. So we are joined by two women who between them have a wealth of knowledge around all things related to young women's health and sex education. Millie and Naomi. Thank you very much for joining us. I'll get you two to introduce yourselves, Millie.
I'm Millie Evans, I'm a journalist and I've been campaigning for better sex education since 2016. I tend to focus on LGBTQ+ sex education, but all kinds of sex education, especially women's health as well.
Thank you.
I'm Naomi Crouch, I'm a consultant gynaecologist and I have a specialist training and special interest in paediatric and adolescent gynaecology. And I'm also the current chair of our British Society, which works with healthcare workers across multiple disciplines in this area.
Fantastic, thank you both. So to kick things off, we know that there's many words related to female anatomy that are used, and there's a lot of misunderstanding around various parts of the female body. I know I grew up in a house where my mum referred to my vulva as my front bottom, which I now know is not the case. So Millie, what's your experience of some of the language that's used and why do you feel like that's important?
So I went to an all-girls school and in sixth form I ran an activism club, and one of the sessions that I ran was about gynaecological health. And as part of it, I had girls shout out words for me to write on the board, like different words that they would use for their anatomy. And you get all kinds of things, some of them super derogatory, some of them just plain bizarre, various things about sheaths and things for swords. There were a lot of strange words people were coming up with. But the thing is that no one actually knew the actual words for their anatomy. And if you asked them to point to it on a diagram, they wouldn't be able to tell you where the vagina was. It was just this was all their vagina. Anything that was kind of below the belt was their vagina. And that's obviously not the case. But it's just that they didn't have the language to be able to talk about what was going on with their body. Yeah.
And Naomi, why do you think it's important that people know the proper language and have an understanding of what bits are where and things like that?
I think it's quite empowering because then you can explain if you're concerned about a particular part of it and you know what you're discussing, but it's more about understanding our bodies and owning our bodies and knowing the difference between a vulva and a vagina. It makes a lot more sense of certain things that you might read. And it's also, doctors tend to use a fairly specific language and you can have genuine misunderstandings when, for example, someone says, well, I've got a problem with my vagina, and I'm looking somewhere towards the cervix, and they actually mean something on the outside of their body. So you can genuinely not be helping your patients in the right way if you haven't understood the language between you.
And so you were talking about the difference between a vulva and a vagina. What is a normal vagina? Does one exist?
There are ranges, I suppose, of what you might reasonably expect, but a vagina is just the tube connecting the insides of the genital area, so the womb and the neck of the womb, which is the cervix, to the outside, so it's the tube that's come together. There are certain reasonably expected formats, if you like, but you can have all sorts of different changes, and so sometimes people have some differences in their body which we might not expect, and sometimes people just like some of us are tall and short, people will have different sizes of vaginas. We don't all come in the same way.
And we've got this excellent leaflet. Can you tell us a bit about the leaflet and how it came about?
So this leaflet came about from the British Society for Paediatric and Adolescent Gynaecology, for BRITSPAG, specifically to try and address the lack of educational useful resource and materials. So we held an educational grant competition, and a grant was awarded to a successful team who wrote it, and they also worked with adolescent focus groups, and so they had all sorts of ideas, and they would go along and they would meet up with adolescents who said, no, that wouldn't work. And they'd say, oh, they'd try and explain something in a certain language, and adolescents would say, oh, what are you talking about? We don't talk like that. So it was a lot of working with younger people anyway to try and understand it. And it really came out from the focus group. So when they were trying to talk about female anatomy and normality and varieties, in appearance, and all sorts of things. And someone said, so what is a vulva anyway? And we thought, well, that's a really good question. So this is a resource that's available. It's available online, and people can use it. We use it in our clinics. It can be used in all sorts of varieties in schools, in sexual health clinics, just explaining what a vulva is. And it's got a series of line drawings as well, just showing the variety that we have in nature, explaining a little bit about vulva and vulval healthcare, and just understanding about your body as you grow to understand all aspects of your body. This is just one more area.
Fantastic. Well, we'll include a link to that resource in the comments as well. And so within the leaflet, you've got this great picture which kind of gives a bit of insight into the vulva and some of the different parts.
Yeah.
Are you able to take us through what's what?
Yes, so I think the first thing is kind of answering the question, so what is a vulva anyway? And really it's this kind of triangular space that's bounded by the top. This is somebody lying down, we're looking right between her legs. You've got
that a bit closer now, sorry, that way.
So you've got her tummy just up here. You've got her bottom down here, and that would be where the poo would come out. And this triangular area, all of this just between the legs, is the vulva, and incorporates quite a lot of structures. So sort of going down at the top, it's a bit called the mons, is what we would call it, and that's where hair would grow if you choose to let your hair grow. So that's sort of where the bone is. And then moving down, you've got the bumpy bit, which is the clitoris. And the only known function we think that clitoris has is for sexual pleasure, for sexual satisfaction. Unlike in male or female bodies, it has no other function at all. It's purely there for sexual pleasure. And it has a little bit of skin on the top called the clitoral hood. And then moving down, you have these inner lips, which are sort of soft and frilly, and they vary in size. And sometimes they're smaller and narrower, sometimes they're more prominent. And again, after the clitoris, they're the most sensitive bit of a woman's body, and they're there to contribute to sexual pleasure and sensation, but also for helping when a woman has a baby later on, and it helps cushion and protect the baby's head. Right in the middle is the vagina. So that's the tube that disappears up inside, and that goes up towards the cervix, where your smear is taken from, and towards the womb, where the periods come from. And these areas either side, which is where the hair would grow, if people let the hair grow, is called the Labia Majora. So that's the larger sort of lips, the larger fat pads, compared with the inner lips, which are the Labia Minora. And then moving right down further, of course, it's the anus, which is the bottom where the poo comes from.
And so in between here, in between the vagina and the anus, what's that area?
So this, we would call this the perineum. So it's a collection of several muscles that all come together, and they sort of form a sort of walnut shape knot, I suppose. And that's when people talk about pelvic floor exercises. There are lots of muscles that go crossways and from front to back to help keep everything tucked up inside. And so that area, this area right just in there, is sometimes called the fourchette. So you will sometimes see that described in books as well, or online.
And so do you see many people who sort of have misunderstandings about where things are and what parts are what?
Yes, you quite often see people who might mistake the clitoris for where they wee from, and sometimes that can be health professionals as well, and if they've been asked to help pass a little tube to help someone wee, they might be putting it in the wrong place. So that is much more tucked up inside towards the vagina. You also see people worried about particularly the labia minora, where they think that it might be abnormal or there might be a growth or something. And so part of my job is actually to talk about anatomy appropriate for age, because it takes many, many years for a vulva to go from that of a child to that of a fully grown adult. And so therefore saying to people, this is fine, this is just part of development, this is what we'd expect at your age for your stage of change and puberty. So people often have worries and concerns, but it's very hard to get proper information available. And I think we historically have not particularly taught it well in medical schools either. So not every healthcare giver has full knowledge and information, and that again was behind the making of this leaflet.
And Millie, thinking back to your sex and relationship education when you were at school, was it anything like what Naomi's been talking about?
Oh, not at all. We don't even think we saw a diagram of a vulva at all in any of our sex education. I mean, I only had very few sex education lessons anyway, but even in biology lessons, it was all about the innards, basically. It was about the reproductive system and the value that had, and you would not catch my school of they would never have mentioned anything to do with pleasure or the clitoris. And I mean, my first time knowing about the full structure of the clitoris, which is like an internal wishbone, was reading a book, which was about sex education. I would never have got that from school.
And so you mentioned about the internal structure of the clitoris. So you can see the clitoris on the outside, but it extends inside.
It is. I think of it like the iceberg. The iceberg was like the Titanic or something like that. So there's a little bit on the outside, but then actually it goes all the way along inside and runs along for about 9 centimetres either side on the pubic arches. So it's quite a big and prominent structure. And I think historically women's anatomy has not been as well studied as male anatomy. And also a lot of anatomical studies would be on much, much older women after the menopause. So there's very little understanding about the vulva after puberty and before the menopause. And again, we don't have good illustrations in our anatomy textbooks. And so the idea about the clitoris being quite such a big structure really only came out in the 1990s.
Okay, so welcome back. We're now joined by Saschan. Saschan, thank you very much for coming along. Would you like to introduce yourself?
Yeah. Hi everyone. So my name is Saschan Fearon-Josephs, and I run an organisation called the Womb Room. We provide information and events and support to young women who have reproductive health problems like endometriosis or PCOS.
Thank you. We've just been talking about various parts of female anatomy and the kind of misunderstandings around what's called what. And I think many people say the kind of internet and media plays a large role in this. Is this something that you've both experienced in your work supporting women and around sex education?
Yeah. Sorry, it's like, you can say something first. Yeah, I think I've done a lot of work in schools teaching sexual and reproductive health, and it comes up quite frequently. Young people not necessarily having the right language to describe parts of their body or to describe their experiences as they're developing, or if they think that maybe they notice that something might not seem normal to them, not knowing how to like describe that effectively or advocate for themselves. So I think like that education around making sure that young people are equipped with that knowledge is really important.
And Naomi, you were talking about how kind of every vulva is different. Do you see many young women in your clinic who have concerns around how they might look?
I do, and I think they probably roughly fall into 2 groups. And so the people who would come along where everything looks exactly as I would expect it to look for their stage of development. It's not widely understood that the inner lips, the labia minora, develop first, and so therefore they will appear more prominent perhaps than it would do on an adult vulva because the rest of the area hasn't fully developed. And so often there's concern about that, and I'm in a position to explain that it's appropriate for that stage of anatomy. And the other group of adolescents particularly that come along are as if one side has grown and not the other. And usually that's people coming along saying, I'm very worried, I've got an abnormal labia. And I will look and I will examine them and I will say, which side do you feel the abnormality is on? And they will always point actually to the side that has normal dimensions and not point to the side that hasn't grown. And so again, it's just an education to explain at least 50% of girls during their puberty development are found to have quite a difference between one side and another, and it will even up. It's just like everything. It's like we don't have 2 feet the same, we don't have 2 nostrils the same, and it will take its time. So I'm able to be in a position to reassure someone saying, this is part of normal development, this is so common you wouldn't believe it. If I weren't, if you hadn't come here with this problem, and I was seeing you for some other reason, maybe checking for a skin condition, I wouldn't have batted an eyelid. This is completely normal, and I see a lot of girls and their concerns.
And I mean, we know that real life vulvas are nothing like we see in magazines, on the internet and pornography. Do you hear from many women who have concerns around not looking like the images that they see in the media?
It's definitely something that gets brought up a lot in my advocacy, but I would actually argue that yes, we know that porn and the images we see in porn do have an impact on people's body image, a massive impact. Also, something that gets spoken about less is social media and the products that are available on the market, because there's a lot of feminine hygiene products, a lot of products which are for things like vulval tightening or lightening or various things that are kind of, they don't pose themselves as like the ideal, but the fact that they're there to fix a problem suggests that there is a problem in the first place. And I think that the fact that there are influencers who do push those products does push people to think, wait, actually, is there something that's wrong with me if I don't have this product, or if that's something that I might need to fix a problem that apparently there is.
And you mentioned lightning and other sort of products that people might use. Do you see many women in your clinic who have concerns around sort of needing to use certain products or needing to shave off pubic hair or anything like that?
I would say the vast majority of girls I might see have removed pubic hairs, and that's particularly a group of girls who will then say that they're very worried because the area feels very uncomfortable. And when I talk to them about letting the pubic hair grow, because that actually helps cushion and protect a very delicate part of the body, they don't always find that an acceptable solution. So I've sometimes given them the wrong solution to the problem. It's rare for people to ask me a lot about different products, but occasionally people talk about feminine hygiene products. And I sort of explain that the vagina is amazing because it comes with its own self-cleaning system, and you don't need to use anything else at all. And in fact, to do so can cause harm or introduce bacteria. And occasionally people worry about the colour. It's very natural for vulval skin to be slightly darker in pigment, and that's just a sign of our natural hormones and our body's doing everything they're supposed to do. I think the interesting area is, of course, people are worried about sort of a physical structure without necessarily having been aware of the function of it. So again, the vulva and the vagina is an incredibly dynamic organ, and I don't think that always comes across when we talk about that medically. We think of it as a very fixed, sort of flattened structure almost, and that just really isn't the case.
And in the leaflet there's a section on taking care of your vulva.
Yes.
So you talk about underwear.
Yeah.
So are there any types of underwear that are better or not so great?
Yeah, so just kind of cotton underwear, letting the air get to it. It's always difficult in winter. We're all wearing tights and all sorts of other things, but some people will find that they get a bit hotter or sweatier. So again, just being aware of your own body and sort of listening into that. And usually, if you find that there's a change in discharge, it's because a product has been used rather than because it's been left to its own devices. One of the first things we say is just leave well alone. Do not overwash the area. Do not overtreat the area. Just let it find its own natural balance.
So there's no sort of special soaps or anything that needs to be used?
No, there's no special soaps. In fact, usually that's the first thing we say to people is those lovely scented bubble baths and shower gels you have, you should avoid it. Vulval skin is quite delicate. And particularly if people do choose to remove the hair, that can sometimes add sort of more sensitivity into it. So again, we often say just let it go back to nature, and then your symptoms will often settle down.
And Saschan, I was just asking Millie before, does this sound like anything you learnt back in school in SRE?
We didn't really have any real education in school. We had one lesson, and we were pretty much like just taught abstinence education. We weren't really taught, outside of biology lessons, we weren't really taught anything else about our bodies or our development. So I think I was quite fortunate in that because my mum worked in sexual and reproductive health anyway. I had a lot of education at home before I even went into school, like from a very, very young age. But even now, there's a lot of schools that I work with where that education is lacking, and I think sometimes there's an over-dependence on the small modules within a science lesson to teach those really important like interpersonal lessons about your body, which actually misses a lot of the like social and emotional conversation which needs to take place about such a key stage in like young people's development as well.
It just goes to show why it's so important that young people understand that every body part is different and everyone's vulva can look different. And I know you mentioned before about labiaplasty. Is that something you're seeing more people in your clinic about?
People certainly ask about it, and when people refer to them with worries and concerns, then usually they've come to a conclusion that they need to have an operation. And I think when you look on the internet and you're trying to get information about vulval development and about the vulval area and appearance, then one of the first things that will pop up is cosmetic surgery websites. And of course, if that's presented there, that tells you immediately, well, that person looked like me, and then they have an operation. So that must mean I need an operation, and that's the only solution. So it's people come in already with a self-diagnosed problem, whereas from my point of view, they have normal anatomy.
I think there's a resource mentioned in the leaflet called the Labia Library, which is labialibrary.org.au, and it's a great resource where you can have there's a gallery where there's various pictures of different labia, and I think it's a really good resource for young people who want to have a look at what different vulvas look like, because there really aren't that many opportunities to
No,
see
absolutely.
real life
Yeah.
vulvas out there apart
Yeah.
from in the media, and we all know that's not realistic. Was there anything you wanted to add, Millie, to that discussion around the media and what's out there, and the kind of social media side of things as well?
I mean, I think that social media and the media always wants to talk about women's bodies anyway, and I feel like gynaecology and anatomy is something that's kind of an odd mix. Either you get people talking about it and talking about it wrong, or you get people not talking about it at all, which creates this stigma about talking about it, and no one really seems to strike the balance very well, I would say, across like the mainstream media. There are obviously smaller organisations who are doing a brilliant job, but on the big accounts and the people who are reaching millions of people, no one's really getting the right balance at the moment, I don't think. And it's also quite difficult to talk about because there's a huge amount of censorship, especially on social media. You have platforms like Facebook, YouTube, Instagram who take anything down the second you start talking about sexual health. And so it's hard for people to actually get that information out there as an advocate when they do actually have the right info.
Yeah, so important that we have the right information out there, as you say, and actually there don't seem to be that many reliable resources beyond what's mentioned in the leaflet.
Yeah, I think that's true, and I think that's why knowing about things like the Labia Library, where people do manage to get the balance right and it's there, then promoting it and making sure people are aware of it. Certainly in our leaflet, that's why we made an editorial decision to use drawings, because they're much more reproducible. You can use them in an educational setting, they could be used in a magazine, whereas something like a photograph, which although visually accurate, is much more hard to be relayed and to get it out there. So it's an interesting sort of dichotomy in a way, that we're not allowed to give accurate information to people because it's seen as obscene.
Yep.
And that's a very interesting balance for me as a gynaecologist.
And I know we've had some pre-submitted questions through. One of them was around discharge, and does it change throughout different times of the month?
It does. Yes, no, it definitely does. So it's normal to have discharge. And sometimes people say, well, if you didn't have discharge, if you walked, then you might squeak, you might make a noise. And although that's not quite true, it's to show the fact that it's completely normal. It's our natural hormones. It tells us our bodies are working. And so throughout the month, then you start off, once you've had your period, with a light discharge. It becomes much thinner, much runnier at ovulation. That's an effect of all the hormone changes where an egg is released. And then after ovulation, then there's more influence by progesterone hormone, and the discharge can sometimes get much thicker, you could almost put a little bit together, and then it leads into a period, and it's completely normal and natural to have these variations in discharge throughout a month.
So we've spent a bit of time talking about the external anatomy. I thought maybe we could talk about what happens in terms of periods and what's normal. Are you able to give us a brief overview of periods, and if you can?
Periods in 30 seconds. So periods will come from the womb. So the womb is shaped like an upside down triangle, and then there's a little channel that goes through, which is the cervix. And so the period would build up from that inside area. It might be worth mentioning that in the corner of the triangle, then you have a fallopian tube either side, and just by that as well, you have an ovary. And I find it quite interesting that our inside anatomy, sort of more or less down right to the very outside, is very much geared towards procreation and creation. And for that reason, you have different nerve endings. The outside of our bodies is connected with pleasure, and that is why it is so sensitive. And so therefore it's not about sort of procreation. So it shows the dual function really of that part of the body, that is, although it's there for having babies, it's also there for sexual function, sexual pleasure, and I don't think that gets mentioned enough. So periods really are governed again by our hormones, and so we have hormone signals that will go from our little gland in our brain called the pituitary. I always find it easier to do this, it's a little bit like an action, and that sends signals down to our ovaries, and then our ovaries are sending signals onto our womb. So you would have a period, the average length would be about 5 days or so. That would start, it's the lining of the womb shedding away, coming through the little channel and to the outside. You then, your hormones are then driving your ovaries to start maturing an egg and then releasing that egg. And some women can even feel a little pop at the middle of the month, and that's known as ovulation. And that's usually around day 14. And then moving on, then that egg is there ready to meet sperm and it will become a baby and the baby would grow inside the womb. But if that doesn't happen, as it doesn't most months, then gradually that will just melt away. And then the period itself is growing up. And the period that would have been a nice soft spongy lining to receive a baby, like a mattress I suppose, will actually just come away, and that is our period. And it sort of cleanses and refreshes and then replenishes, and the whole process starts again the next month. And the average cycle length is over about 28 days, with ovulation being in the middle.
And in terms of blood loss, what's the kind of normal amount that a woman should expect?
It's hard to know how to measure it actually. So we've looked at saying, should it be that you look at a picture and say it should be a little sort of splot on a tampon or on a pad. But generally speaking, we would say it's over 5 days. There shouldn't be clots, which would indicate quite a heavy bleed. And you should be changing some sort of a pad or a tampon every sort of morning, every 3 hours or something like that. Once people are saying I'm changing a tampon every hour and it's soaked through, or I'm changing pads several times a day, that to me would sound very heavy. The official definition is if it's more than 80 mils of blood in a cycle, but realistically no one has the ability to measure periods, and so it's a little bit arbitrary. So we really tend to go on, are you passing any clots, how often are you changing your sonometry around?
And what do you mean by a clot?
So a clot would be a lump of blood. So if you cut your thumb or something, it would start bleeding, but after a while it becomes a bit lumpy, and it's the mechanism our body uses if we're losing blood to try and stop us bleeding too much. And so it's a sign of periods being heavy. It means that you're bleeding quite a lot from some of the blood vessels, and so therefore it's actually forming a clot. And normally you shouldn't be doing that in most of your periods.
Saschan, Naomi's spoken about what's normal in terms of periods. Does that sort of ring true with some of the women you support and yourself and kind of experiences over the years?
So I think when I first started my periods, I think I was quite lucky. Like my periods were quite regular. I didn't have any pain. They were also quite light. And then after I had surgery and I had my right ovary fallopian tube removed, and then I had my diagnosis of endometriosis a couple of years later, that was around the time that I started to notice like changes to my periods, where my periods would be more irregular, the length will vary, periods are a lot more painful, and even the symptoms that I get like leading up to my period are more prone to bloating and pelvic pain. I think a lot of the women that we support as well have very similar experiences with their periods. Their periods can last, I think I spoke to someone the other week, and they said they've been bleeding for like 30 days. And so I think like making sure that you're aware of the patterns in your own period and noticing the signs and symptoms that actually something might not be 100% right is really important. Just one, for the impact that it has on your quality of life when your periods are really difficult, but also so that you can get the right support and get the most out of your GP or any other medical professional you might see by being able to describe what you're experiencing in the best way and most comprehensive way possible.
And Millie, do you think that we're taught enough at school about periods and kind of when to be concerned and things like that?
Definitely not. I mean, the number of conversations I had with people at school where they were like panicking about their period. I mean, everyone was very open. It was an all-girls school, and you could just scream across the classroom like, anyone got a tampon? And someone would give you one. But so many people didn't understand about their bodies, and I was one of the first people in my year to start using a menstrual cup, and everyone was like, that's disgusting, like how could you do that, that's so gross. And I was like, actually it's enabled me to understand more about my body. I now understand my flow, I understand when it's heavier, or like how the texture changes throughout my cycle, and they did not like it at all. But I really agree with the idea of tracking your periods is not something we teach in school. I've done it since day one of starting my period, and because of that I was able to not just track my period but also track my moods, which for me was really important because I've had really bad PMS, and I wouldn't have understood how my mood was changing throughout the month had I not been recording that on an app, or some people do it on paper, but no one taught me in school to do that. And I think so many people would be better off and be able to have better conversations with a clinician when they have to see one, if they were able to actually have that visually written down.
Such a good idea, and definitely something we should be teaching at school. And Saschan, you mentioned painful periods. Is this something you see many young girls within your clinic, Naomi, in terms of pain?
Very much so. So I was interested in you talking about your experiences and with people as well that you've supported, and it's very common. So although I've talked about sort of a normal period cycle, if you like, then we think that up to 75% of girls when they're starting periods will have abnormally heavy periods. And it's usually related to the hormone cycle just not having fully matured, and it can take a while to get there. So although we have an understanding of why it happens, it's still important that it's treated. Certainly girls may often be missing a day or two of school every month because their period is so heavy. And worldwide, if you look at the medical literature, women and girls are often missing out on significant chunks of education because of their periods. So at the very least, we should just even it up, make it a level playing field, give proper management. So all the girls have to worry about is then school and all those things. And I can't help with that, but I can help with their periods.
And obviously there's free sanitary products now in schools, which, or very soon, which hopefully will make a big difference as well.
Absolutely, for period quality.
And is that something that you're doing work around with your SRE work, Saschan?
So we encourage schools to provide period products for young people at school. Scotland has just become the first country in the UK to actually provide them nationally, and I definitely think other countries should be encouraged to follow suit, particularly given issues around period poverty, or even just it can be really embarrassing culturally to talk about menstruation if it's not something that's discussed within your family home, and to have those conversations about getting access to products. If you're caught short and you didn't know that your period was coming, for example, that can be difficult to navigate. So I think removing that barrier for young people is really, really important, but also I think that extends, I think, for me, throughout the rest of women's life course. Removing that barrier in work is also equally important, and there's been some companies that we've worked with who have provided free products for their staff, and I think implementing period policies where your employees can have access to free products, just like they can get access to free toilet roll, is equally important.
And we've had a question through from someone whose daughter is 16 and she's never had her period. How long should she wait to see a doctor about this?
I think it's something she should be seeing her GP about now. So generally speaking, I'm assuming that because she's been waiting for her period, I'm assuming she's had other signs of development, so some breast development and some hair growth. If she hadn't had any of those changes at all, then I would have advised at the age of 14 she should see her doctor, but certainly with otherwise normal development, and this sounds like the right time.
And what is the average age to start your period then?
So it's about 12 and a half years or thereabouts, but it takes about 2.5 years from the start of breast development to getting your period. So periods are quite a late part of development. So if you're 16 and you don't have your period, that's further behind than we would expect.
And obviously it's why it's so important that we're teaching young women about periods at primary school, really, in the run up to sort of secondary school and things like that. They can't be starting off with misunderstandings and lack of knowledge around that.
Yeah, absolutely, and just understanding how your body works, because once you understand how your body works, you can then notice if there's something different that shouldn't be there, and then talk to your parents or someone else about it. It means that you know what to look out for.
And so touching on that, what should people do if they have concerns about their vulval health or periods? What would you recommend?
So I think GPs are always a good source of advice, and GPs can often access hospital doctors if they're not sure themselves, and they could just ask for some advice and guidance. Looking online, we've talked about some resources already, and obviously the Brits Pack resource, it has information leaflets for patients, and it's designed to be used in conjunction with a clinical consultation, but sometimes it's quite useful for patients anyway if they think, oh, I've been told I've got heavy periods, what does that really mean? So we've got just single one-page leaflets which are clear and easy to understand.
And we'll put links to all of those leaflets in the comments section as well. And what should people do if they don't feel comfortable discussing this with their GP? Have you got any suggestions as to how they might raise the subject, Saschan? I don't know if there's any suggestions you've got for kind of broaching those topics with healthcare professionals, or why people shouldn't feel embarrassed about talking to doctors about it?
I mean, at the end of the day, doctors see all kinds of things that we would all consider embarrassing, and and so your concern probably isn't the weirdest thing that they've seen today. And so I think kind of trying to put it into perspective in your head that this is a professional, they're going to behave in a professional manner, they're going to treat you as a patient who they respect, and they're not going to laugh at you like you might feel like you'd be laughed at by a friend or a colleague if that was a concern of yours. They are someone who knows, they know what you're talking about and they know what they're talking about. And kind of getting comfortable with the language yourself. You don't have to go out and be shouting these words if that makes you uncomfortable, but just kind of getting comfortable with your own anatomy and educating yourself can make you feel a lot more comfortable when you actually do have to discuss that in a more clinical setting with a doctor or a gynaecologist.
And Naomi, would you recommend that people get out a mirror and have a look and kind of get familiar with their own body?
Yeah, absolutely. I think that's always really useful. And again, they can sort of look, compare themselves to some of the line drawings and get some understandings. And also GP practices have nurses. Sometimes people might find it a little bit more accessible. Nurses are often responsible for doing older women's smear tests and things. So again, they have a wealth of experience, and that might just feel a little bit more reassuring for some people if they're genuinely very worried about seeing a doctor.
And Saschan, some of the experiences of the women that you've supported, what's been their experience of seeking support from healthcare professionals?
I think it kind of depends. Sometimes I think there can be a cultural barrier. Different people will culturally use different language to describe different parts of their body, so that can cause issues in how people communicate, like what it is that their issue is that they're presenting with to their doctor, and can sometimes create misunderstanding. I also always encourage people to, if they don't feel 100% comfortable or confident going on their own, there's nothing wrong with having somebody with you who can advocate on your behalf, someone who you trust and you feel comfortable having that conversation with, who can come into the room with you and can be there to help facilitate and navigate that conversation. But I also think not over Googling your symptoms, because that can just create unnecessary panic. I think it's finding the balance between knowing enough about your own body to know that something is wrong, and then knowing how to kind of communicate that effectively, but also not over panicking and going on Google and thinking that you're going to die, because 9 times out of 10, like, it's something that is treatable or fixable. Actually, there's nothing wrong at all.
And accessing those reliable resources online as well. Well, I think we're coming to the end now, but I was wondering if you'd like to give everyone a takeaway tip, your kind of number one thing in terms of vulvas, vaginas, periods, pubic hair, anything related to younger women's health that you'd like to get across to people. Should we start with you, Naomi?
Good start with me. I would just say that I would really echo all the discussions we've had today about understanding more about your body. It's your body, it's no one else's. You get to say what happens to it, and you get to have an understanding of it and how it works. And if you do have fears that you can't reassure yourself about, seeing a doctor is a very good way forward, seeing a GP. They really absolutely have seen it all before and have a wealth of experience. And as you say, it's certainly not going to be the most weird thing they've seen, probably even that day. So just to reassure people to seek help if they can't be happy about things.
Saschan?
That's a good question. I think my advice would be to find somebody in your life who you can disclose to, or you can have open and honest conversations with. I think a lot of the time you can have an issue, or you think that there's an issue, and you feel very, very alone with it, and you don't know who to talk to. That's not necessarily always going to be your parents or your caregivers, so it might be somebody else, it might be a teacher at school, it might be one of your friends' parents if you're a young person, but finding someone else who you can also just talk to alleviate fears that you might have, or just somebody to make you feel listened to, I think is really important.
Thank you.
I'd say it's okay to be curious, it's okay to ask questions about your body, and there's nothing to be ashamed of if you do have questions, even if you consider them to be weird or embarrassing. Everyone's curious, we're humans, we're made to be curious, and there's nothing wrong with being curious about genitals or your body.
Well, thank you all very much for joining us, and do tune in for another Women's Voices webinar soon. Thank you.